Well, welcome back once again to Talking with Tech. My name is Lucas Stuber, joined today by Rachel Madel. How are you?
I'm doing good. How are you doing, Lucas?
I'm good. I'm wearing a very loud shirt today.
I wish that our listeners could see the outrageous attire you have on right now. It's the most bold pineapple shirt I've ever seen.
It's very garish. It's really, really over the top as far as like these just fluorescent pineapples all over the shirt. I went to an AAC meetup actually in this shirt some time ago, and I was trying to say something, but a lot of other folks were talking, and somebody stood up and said, "Let the pineapple speak." And so this has now become the thing. So I'm sorry, listeners, you haven't seen the shirt, but maybe I'll post it in the Facebook post.
Maybe we'll do a screenshot of this and show everybody how ridiculous you look.
It's the best shirt ever. Well, I'm really excited today. So we have Vicki Clarke on the show, who's a really talented and proficient SLP and AAC expert. So I'm excited to hear from her. And one thing that came up in our conversation with her that's also been coming up for me professionally and, has been asked in the group is basically how to manage vendor relationships, right? So, I think we've all seen this situation where maybe, or been in this situation, right? Where you're really familiar with one app or one solution because there's a really strong presence of that company in your area, right? Whether that's Toby or PRC or Proloquo or whatever it might be. And that's a challenge, right? Because we definitely don't want to have everybody using the same device, right? But on the flip side, there's really not like blame to put there, right? Because it's hard to get trained in these things and it's hard to get access often.
Yeah. And honestly, it's really been valuable to me to develop really strong relationships with the vendors in my area because, as you mentioned, they know these systems, they know every detail that you could ever imagine. So if I have an issue, I have somebody to go to. And because I've worked at establishing these rapport, it's really quick to send a quick email and ask a question, set up a coffee date and go over programming aspects that you might not be as familiar with. So it definitely can be really beneficial, but I can understand how there's the opposite side of the coin and you can get too close for comfort.
So let's look at some studies, right? So one case I guess I would have would be somebody who doesn't have access to all of the different solutions. Like say you're a school SLP, you have a new student move into the district, who's using like a Toby iGaze device, and you don't have any experience with iGaze or with Toby. Of course, it's going to make a ton of sense to reach out to that company and get trained in that regard. Mm-hmm. I think where the danger lies then is that next time that you have an assessment for a similar situation, making sure that you aren't always falling back on the same tools just because those are what you're familiar with, right?
Yeah, and I think this is something that I deal with a lot and I think about a lot in my practice because we all inevitably will fall back on the things that we know and the systems that we know best. And sometimes it's just kind of incidental, the systems that you learn as an SLP. In my area, Proloquo is everywhere. So I would say that I know that system better than any other system only because I've worked with so many clients that have Proloquo. So I think it's important, though, to recognize as a clinician when you want to expand your horizons. So you don't want to just fall back on everything you know. There's so many apps out there. They're constantly updating them too. So just really having a pulse on what's out there, what's possible, especially if you have a child who isn't fitting very nicely into that system that you might know well. It's really our responsibility as clinicians to really search out other alternatives. And if that means, reaching out to a different vendor and getting a demo set up, that's kind of what it takes. And I just think that as AAC clinicians and specialists, we really need to prioritize making those relationships and knowing at least just a little bit about all of the options out there.
Well, and so when you say responsibility, what we're really talking about here is ethics. ASHA actually has a very well articulated set of ethics or professional guidelines. So let's see what they have to say. So Rule of Ethics 3B says individuals shall avoid engaging in conflicts of interest whereby personal, financial, or other considerations have the potential to influence or compromise professional judgment and objectivity. So this is specifically speaking to, these other obligations, right? So a good example is, I personally obviously have worked in the past as a developer. I have a financial relationship with the company Avaz. And so in my practice, when I'm working on a situation where a student could potentially be eligible, could use that tool productively, the sort of system that I put into place is that I always have a second SLP sort of double check my work, right? Go back through and make sure that I'm not biased in some way. I think this is a little different from other industries. Like we're not getting, I haven't had any champagne yacht tours given to me by like Toby.
I'm still waiting, actually.
Yeah.
I'm hoping that's in my future.
Yeah, Toby, if you're listening, I'm sure we can work something out. But very, very infrequently, I think, would there actually be like a financial tie. But there is, a sense of, a relationship. If it is so much easier to get a loaner from that company, or if you're receiving copies of the apps for free or those things, I'm not at all saying that we shouldn't do those things. We need access to those tools, obviously, but I think we need to be mindful about it, right? Make sure that it's something that we're considering when we're making those recommendations. Is, am I doing this because it's benefiting me, or am I doing this because it's easy, right?
Yeah. And I think that, you mentioned a vase, Lucas, and I think it's a really good point. With that being said, with an app that you created, obviously you think it's great. You were part of that process. So I think it's okay to want to recommend what you think is the best out there. And a lot of the work that you put into that was because of where you're coming from as a clinician. I love the second SLP kind of backup check. That's a really good strategy to just say like, hey, just want to make sure and not, coming from an unbiased opinion. I think that's a really good. I don't know how practical it is. I'm trying to think of other SLPs that would, be kind enough to do that backup for me.
I chose one that really enjoys giving me grief. So I think that
okay, perfect.
I think she enjoys it.
Yeah, I can barely have 15-minute phone call check-ins with the other specialists that I know in my area. We're all like chickens with their heads cut off, busy trying to do evaluations and consultations and all these things. So
sure,
it's hard.
Well, and that's a great segue, because then here's another situation, right? Is the situation where you maybe are working in the schools in a large district, and they bought 200 codes to app X, right? And that's the solution that they would prefer to be used with all the students. And we had an episode with Eric Anger where we weighed potentially some of the pros of a situation like that. But again, looking at what Asha says, right? So rule of ethics 4B: individuals shall exercise independent professional judgment in recommending and providing professional services when an administrative mandate, referral source, or prescription prevents keeping the welfare of persons served paramount. So what they're saying there is essentially, if this administrative mandate, for example, is requiring a solution that's not the right fit for the person that's served, that we have an ethical obligation to not abide by that, right? That's challenging.
Yeah, it's really challenging. And, I wonder for all those school-based SLPs, they find themselves in this exact situation, right? It's like, we only get licenses for these specific apps. What do I do? Because these specific apps aren't working for this child. So I think one solution is, obviously going to your administrator and trying to get an exception to that rule, realizing, listen, I know that we have licenses with these companies, but, here's the data. Here's why this is not a viable option. I think it's our clinical responsibility to do those things and to be advocates for our clients in getting the best possible system for a child as we can.
That's what the ethics is all about, right? Is that it's not just about adhering necessarily like verbatim to the code, although that's part of it, but it's also about advocating for your students when you see a situation that you don't think is benefiting them, right? Doesn't reconcile with your ethics. So one thing that I would suggest to people as a sort of an easy way to to start working through this is, yes, go ahead and contact the vendors and contact all of them. Don't just have that one relationship, but get in touch with AssistedWare, get in touch with AbleNet, get in touch with Toby, with PRC, with anybody that you want to work with. You shouldn't be afraid to send those emails. Like, everybody's happy to get them. We're a happy little family in the AAC world, and of course they obviously want people to learn about their products too. But that's one way to sort of reduce the bias, is by making sure that you're involved with everything.
Yeah, and I think that I often have a lot of SLPs who I consult with, so they might not know a lot about AAC, and that's kind of my role, is to teach them. And the number one question I get asked is, what trainings can I do? What's out there? And, I wish I could say that there's a ton out there. There's not that much, but there is a lot of stuff. And all of these companies, they do a really good job of supporting clinicians who want to learn more about their products. And instead of watching, YouTube videos on programming, I really, like you said, Lucas, recommend just getting in touch with your local rep, and they can show you everything. I don't know about you guys, but I am such a visual learner. So for me, what would take, eons reading in a manual would take 10 minutes of me just playing around with, a system and a device and asking the questions that come up. So it's not it takes a little bit of extra effort to kind of have that meeting set up. But, at the end of it, I feel like you know the system a lot better. You have built a rapport with that rep. So if anything comes up, you're able to contact them and ask them a question or get some feedback. And a lot of them will, join you in the assessment process, which is also awesome. I love having other clinicians input because it's so eye-opening. There's no one way to, do therapy. There's no one way to do, a great AAC assessment. I'm constantly amazed that when two SLPs are in the room, all of the ideas that are flowing and things that I would have never perceived, they pick up on. So I just love that collaborative piece too, which is great.
Yep, perfect. So it's a free second set of eyes, and who doesn't? Is it? I don't know if anyone listening has enough time on their hands that they just have free people everywhere to help them out, right? Like I don't.
I know. I have a student intern right now, and she's fantastic. And I'm like, how am I ever going to go back to therapy by myself? How am I ever going to not have that extra set of hands that's doing anything I might need in the middle of my sessions? It's going to be a rough transition.
Yeah. I'm sorry, poor you.
I know, poor me.
In any event, I think that it's I think it's important to think about all this stuff. I also think that it's important to make sure that you're taking advantage of every tool that you have at your disposal to serve your students, right? And I can tell you that there are plenty of situations, especially in the world of eye gaze and alternative access, where I would not have been as successful working with students if I didn't leverage the relationships that I have with vendors. Mm-hmm. So I encourage folks to go out and do that. And I tell you, this from an ethical standpoint, that's all on their mind too. I mean, I haven't encountered a situation where someone in a vendor or even a developer situation is really thinks that their solution is going to be 100% perfect all the time, right? I mean, they'll work with you.
Absolutely. And I think that, we're in a helping profession, and anybody who's, a part of AAC that I've come into contact with, they just want what's best for the child. And, if that's their product, great. If it's not, they'll be the first ones to say, trial a few and see what happens. So I agree. I haven't had any situations where, somebody was really pressing me to recommend their specific product. They're really open for the most part, in my experience.
Yeah. And I don't think anybody really gets into this work in any capacity in a non-loving way, right? I haven't met any greedy millionaire speech pathologists
no.
But again, Toby, Champagne Yacht, come on.
Yeah. I'm waiting for my invite.
Well, we want to hear what you guys think. So feel free to shoot us an email at tech@speechscience.org. Find us on Facebook. We have a Talking with Tech group that's well active, as well as a page. And then, of course, Instagram, Twitter, all those places. I'm pretty glued to my phone. I don't know about you, Rachel, but I'm bad with the social media.
I'm really trying to put some distance between my phone and I, because it's such a time suck. I'm like, oh man, here I'm on this funnel down the Facebook lane, and it's hard. So I've been setting some boundaries with my cell phone. But I do love social media, so you'll often be able to find me there.
Oh, and that's an extra little reply. But please do let us know what you think. I know this is I wouldn't say a super controversial topic, but it's something that definitely comes up. So we're curious how you all have found solutions in your own practice. But all that said, we're really excited to listen to Vicki Clarke, so we'll go ahead and share that with you starting now. Well, welcome back once again to Talking with Tech, part of the Speech Science Network. I am, as always, joined by my friend Rachel Madel. How are you today?
Fantastic.
And I'm super excited today to be joined also by Vicki Clarke. How are you?
I'm awesome.
Where are you located?
I am outside of Atlanta.
Vicki, if you could tell us a little bit about yourself, what brought you into the field and what you're doing now.
So I'm a speech language pathologist by training, but I've specialized in augmentative communication for my entire career. I got into it in my second semester of graduate school. I got to be on an AAC evaluation team at the hospital at UNC Carolina and got hooked on augmentative communication at that point. That was 1989, so it was a few years ago. And I've been specializing in AugCom ever since. I worked in the schools when I first started, and then I moved to Georgia, and I have been in private practice by myself for a while, and now I have a a practice dynamic therapy associates. I have 4 full-time therapists and 3 part-time therapists and several assistants. And we do private clinic-based evaluation and treatment, implementation with families. And then my job right now is a division of our company called DTA Schools. And I spend about 80% of my working life out in on contracts with 6 school districts providing augmentative communication services. So we do student-based evaluation. We do training for staff, for therapists and teachers. We help the school system facilitate getting communication devices funded for the individual students. We create materials. So that's kind of taking up all my professional life at this point.
Great. So do you do any in-home work as well, or is it all school-based?
I'm all school-based right now, and my therapist, we do everything in clinic right now. Just from a funding perspective, we can't really afford to go out into school, so we're not doing any into homes, so we're not doing any home-based services.
Got it. That's similar to what I've done before, is contract directly with school districts, and it can be more lucrative. And the other thing I found, and I don't know if this is true for you, but I really like working with students, I guess, in situ, if that makes any sense, in their actual environment where they interact with peers. Do you feel like that's something that's beneficial for them?
Oh, absolutely. I think, I worked in private practice for so long, and I had my students for an hour a week. And, what happens in the therapy room is not really what makes the big difference in terms of kids learning how to communicate. So, you work with families and get them on board and help them with implementation. But then these kids are out in their classrooms for over 30 hours a week. So I feel like that by being able to get out into the schools, if I can make an impact there, if I can train these teachers and parapros so that kids have access to communication all day, that's going to be significantly more impactful than anything that I can do in an hour in my therapy room.
I am always kind of preaching that message. I'm also in private practice and I specialize in AAC, and that's our role, is to teach these caregivers what to do, because we can only be there at most a few hours a week. And oftentimes I don't even get to see the kids that I work with that often. So right. I completely agree. Going off of that, what do you find is the biggest roadblock that you're finding when you're trying to teach in the schools?
Really, I think it is getting the teachers to give me the time that's needed to do really good training, and convincing them to take the time to do the implementation planning that they need to do in order to make it successful in their classrooms. So I think that time is an issue, or the perception of lack of time is probably the biggest issue. So I think part of what I have to do is I have to do a good sales job with the adults around the child, convincing them of the importance of what we're doing so that they will prioritize it, so that then they'll have time to work on it with me.
And I think you bring up such an excellent point. It's the perception of lack of time. I think that it's this idea that I have no time, I can't possibly add anything else. And what I try to teach to the teachers that I'm working with is, sure, there's some upfront planning that goes involved, but this is something that if we plan into these activities that a lot of teachers use from year to year, you already have the supports in place. So it's really just a little bit of upfront work that doesn't take nearly as much time as you might think it does, especially when you kind of get into a rhythm. Right. And then the more you do it, the less planning it takes. Right. That's
right. And I think that I was thinking about this a lot over the past year. Why do I struggle with trying to get everybody on board? Why am I not able to convince them that augmentative communication is super important? And I had the realization at some point back in the spring this year, I thought, the issue is really not that we're not prioritizing augmentative communication in our classrooms. The issue really is that we're not prioritizing communication, period. Right. So not just for our non-speaking students, but all of our students, really not focusing on the fact of how important communication is. And so I think what happens is that when I come in, I get lumped into the same category as, well, we got to teach science, and we have to teach social studies, and we have to teach language, and we have to teach all of these other goals. And what I'm coming in there with AugCom, it's just one more piece that they have to teach. And so I've changed my approach to training with our staff now, where we start our meeting. We start our year off this year with I kind of tongue-in-cheek called it my come to Jesus meeting. And we talk about why are we even discussing communication for our students, and what we're required to do in the school district in terms of legally what we're required to provide as far as communication supports are concerned, and then how much that communication impacts every single thing else that they're teaching. Who cares if you know science and social studies, if you understand everything there is to understand about matter and Abraham Lincoln and electricity, if you can't communicate those things.
Right. And that's I think a lot about ADLs, right? Like access to activities of daily living. That's one of my biggest priorities, especially as kids are aging out of the school system, right?
Mm-hmm. Yeah.
I'm sorry to have interrupted, but you reminded me of something that I really like that you might too. That I used to always harp in conference presentations on this idea that AAC intervention is just language intervention.
Yes.
Right. And that people shouldn't, be afraid of it because a lot of the same principles apply, to what you're doing in other situations. And then recently I did an interview with Melanie Fried-Oken, who's up at Oregon State Health Science University.
Yep.
And she put it a wonderful way. She said that it's not actually language intervention, that it's communication intervention.
Yes, absolutely.
And I really like thinking about it that way, right? Because it's in many ways, communication or effective communication is modality independent, right?
Yes, yes. Absolutely.
So,
I've been separating that out a lot because we have a lot of our I work with a lot of students with autism, and we have ABA specialists working with us a lot, and we kind of have that discussion around functional communication training and discrete trial training. And so what we've been talking about is that there's a difference between language and articulation, how you speak, and the purpose, and that the purpose of all those are the tools we use to communicate, right? So trying to think through, it doesn't really matter, all of those tools, whether you're doing AAC or you're speaking or you're writing or typing,
or gestures
or facial expression, all of those techniques are just those are the tools we use to get to the main point, which is communication, to be able to functionally interact.
How do you feel about the encroachment of ABA? I mean, that's a loaded question, but you don't have to answer it.
Just going straight to the controversy, aren't you?
I am. Or even OT. I mean, ABA is pervasive in California and Oregon and Washington, and I don't know how to feel about it yet, because there are elements of AAC intervention that do lend themselves well to DTTs, right, to discrete trial training, but not everything.
I've had different opinions about what's happening with ABA and speech and language. And I know that there's a lot of controversy and argument between the two fields, but I've worked with ABA specialists that I thought were phenomenal. And so I feel like that there's a lot of value there. And I think it's probably not an either or situation in terms of what is valuable to our students. But when I've been, working with the ABA therapists about really thinking about what they're targeting. And I think like when we were talking about that distinction between language and communication, that's how I sort of address this ABA speech therapy thing. I feel like that when we're sitting down in discrete trial training, what we're teaching is vocabulary. We're not teaching functional communication. We're teaching vocabulary. We're teaching language, pieces of language, right? So is there value in discrete trial training? Well, I think there is for some of our students who really, really struggle with that basic vocabulary. Now, I'm personally a big picture person, so I don't hang out too long in that discrete trial land. I do understand why there's value in it. Now, to me, the perfect combination is if a child needs discrete trial training in order to focus and filter and learn language and vocabulary, that's great. And then we have to also pair it with functional communication teaching.
Right.
So we have to, and I think that some of the value for our ABA specialists is that if you get an ABA specialist working with you for functional communication teaching, they are amazing. They can be amazing at helping us to take that functional communication, that activity, and structure it in a way that the student with autism can understand it very well. So I feel like that if you've got a skilled ABA specialist and a skilled AAC specialists working together. That's probably the best of both worlds. Where we have problems is when we have less than skilled speech pathologists and less than skilled ABA specialists. And then we get into a whole big mess.
Yeah. And I also think that you just hit the nail right on the head. It's all about the collaboration. If we can just kind of come together and utilize the resources that we have and the training that we have, and compromise in a lot of ways.
Yeah.
I think that's the key, because as you mentioned, there is a place for some of that discrete trial training. Another thing that, because I work very closely with ABA teams, and I value them because they have the hours, right? Like they have the 30 to 40 hours a week.
Very true. Yeah.
So if I can get them on board, it's such a win for, device implementation. So I am always trying to, work with them, collaborate with them, and know that at the end of the day, what they're doing is not speech therapy. So I have to kind of let go of some of the things that I might do differently. But as long as we have a roadmap of where we're going and how to make communication functional instead of just that discrete trial training, I've had a lot of success. So I don't think we need to be at war the way that we sometimes kind of get into our speech therapy versus ABA disagreements. But if you can collaborate, I think it's a win-win.
I agree. Yeah. I think it's nice that we have, you talked about all the hours that ABA has now available, which is pretty amazing. And I would like us to do a better job in our profession of increasing our funding.
Right? Wouldn't that be great?
But still, it gives us, you're right. If you can get an ABA specialist on board and they're helping implement what we're recommending, and you can do that 25 hours a week, that's great. And then we also need to be talking to them about how in the world they got that kind of funding.
Yeah, right.
Well, and some of them vary state by state. I know that Autism Speaks, for example, did a great job with their attorneys of, pushing ABA in a variety of states. But there, and you spoke to this. One thing that I talk about a lot is that SLPs, when they're coming out of grad school, their scope of practice is often very broad, but very shallow, right? Like I work a lot with AAC. I'm not about to go do a modified barium swallow. That it's within my scope of practice, but it's not within my ethics.
No. Yep.
But ABA, and I'm sure I'll get a mean email about this one, but I feel like it's very narrow but deep.
Like what you said, speech pathologists, I think a lot of times in our school districts are general practitioners. So they have to know a little bit of everything. Right. I am not a general practitioner at all. I mean, I don't know if you come to me with an issue with fluency or voice, forget it. I mean, I don't remember that stuff at all. God help me if I had to do a barium swallow. I would not know what to do with that. So I think that probably our ABA therapists really line up better in terms of the depth of knowledge with specific AAC specialists, because we have a very in-depth knowledge of this teeny tiny piece of our practice. So that's a good combination. I think probably when we have general practitioner speech pathologists working with ABA specialists, that we may get into more difficulty in that scenario than we do when we had the AAC specialists and the ABA therapists together.
That's potentially a really excellent point that I never ever thought about, Vicki. That makes so much sense to me that we kind of a general.
Well, there you go.
Because the ABA does so many different things, right? I mean, they're working on all types of skills and across every discipline. It feels like, whether it's sensory regulation or activities of daily living or you name it, they're kind of working on all those things. So, and I found that when I come in as a specialist with a very specific purpose, they're very willing to collaborate, and I think that's such a interesting thought. I've never thought of that, but that makes so much sense.
Well, it's like we said earlier, it's kind of a little controversial subject, and so I like to think about these things. I don't want people. I want people to like me. I don't want people to be mad at me.
I know. I'm the same way.
So, speaking of controversy, you're somebody that has a lot of experience in this field. Are there certain apps or devices or even methodological approaches that you like more than others?
Well, so I'm glad you asked that question, because I tend to I get lumped in with one particular company a lot of times, because I've spent a lot of time working with their devices and with I think with their educational team. But I actually have a device or an app that I think is better for all students than any other one. So I would say that I think it's really important for us to have comprehensive communication apps and software programs available to our students. And by that, I mean, I want our devices to have all the different tools that our students need to communicate. So I want our devices to have core vocabulary. I feel like that's really super important. And I want our devices to have a keyboard because we know our students need to learn, they need to improve their literacy skills. We know that that's an issue with AAC users. So we need to have access to a keyboard. I think in terms of rate enhancement, it's very helpful to have access to some topic-based stored phrases on our device. So, some of our companies do that with context-based messaging, and we have others that have social-based pre-programmed phrases.
Yeah, like quick fires, sort of things.
Yeah, like quick fires, quick messages. Social messages. So I really feel like we need to have all of those things. I kind of want it all. So devices that I prefer are devices that have all of that, or apps that I prefer have all of that. I want I want core, I want keyboard, I want topics and phrases and social messaging. I want every piece of that. And so really when it comes down to picking which one of those I go with for a particular student, it really comes down to what is their easiest form of communication. Like, what do they need the most, and what are the features that they require in a system? So, if I have a student that's really struggling with social interaction, and maybe I had a young boy I was doing a report on today that I evaluated, and he wants to be very social, but he really struggles with understanding, what are appropriate things that I can say in these different environments, right? And he also is a young man who has echolalia. So when you give him appropriate statements to choose from, he can pick them. So this little guy, I feel like it's beneficial for him to have topic-based topic-based pages and social messaging pre-prepared for him so he can quickly access and choose appropriate social messaging, right? However, that kiddo also needs core vocabulary. He needs to be able to produce generative language, right? So he's got to have a device that has all of this. But because I definitely want that topic-based instruction, that young man, I went towards a Tobii Dynavox device. Now, I have another young lady that I wrote a report for yesterday who has difficulty with visual processing. So when I give her a communication device, it's hard for her to look across the whole grid and scan the choices that she has and find what she wants to communicate. She really uses her motor planning more than she uses visual access. So I need a device that messages don't move around. And that's really the most predominantly important thing for this young lady. So for this child, we are going with an accent all day long because on the PRC accent devices, motor planning is a huge component. So I know that I can teach her a motor plan at a 15 location, and when we move to 28, it's going to make sense. They're going to be about in the same position, and we can build her language that way. So I think she still needs some social messaging. So we'll probably add some social messaging in for her. But for her, it made more sense to me to go towards an accent device. So I don't have favorites. Now, I think that, to make a short answer painfully long, I think that early on in my career in private practice, we had a great number of emergent communicators come into our practice. And those are kiddos who their communication was so significantly impacted that it made sense to their parents to pull them out of school and bring them to speech therapy, right? Yeah. So in early on, some of those emergent communicators, some of the high-level core vocabulary and multi-meaning icons are challenging for those emergent communicators. So I tended probably towards more systems that, not as many systems that had that multi-meaning icon base and core base because they were emergent communicators. As I've gotten out into the school districts now, it's much more balanced for me because I have more students who have kind of a broader range of needs, if that makes any sense.
Yeah. So going back to those emergent communicators, is there a system? I mean, obviously we want to support core vocabulary for down the line because you want a system that grows with a child.
Yes.
Are there any specific systems that you feel like are really good starting off points for emergent communicators?
So that's an interesting question because I think I would have answered that differently a couple of years ago than I do right now.
Yeah.
Our emergent communicators, I think when they're really at the very early stages of learning vocabulary, their kiddos, your first 10 words are not often core vocabulary words, right? They're just not. They tend to be specific words, right? So we want to make sure that our emergent, and those are the motivating words for them too. So, our emergent users, at first we're trying to get access, we're requesting things that we're really motivated by. So we want to make sure we have access to those some of that fringe vocabulary. I think that I had better access to that in the past when I was using my Tobii Dynavox and my Saltillo products than I felt that I did with my PRC and my Accent products. However, PRC, the Accent now, this latest update that they did, they're giving us a lot easier access to that fringe vocabulary from the get-go. It's right there on the main page where we can get to it for our students. So I feel like now I can use those systems more for kids who are or people who are emergent communicators than I used to be able to. And so now when I'm making the decision, it's not as much about whether you're an emergent communicator or not, and more about, do you need, like that visual planning business, that's an important piece. Is core vocabulary the most important piece of your instruction? Do you need access and support for social messaging? I mean, do you need supports for daily, communication around activities of daily living? Certainly Tobii Dynavox has got that really going very much for it, so
right.
It's not really as much like it used to be for me about emergent communicators versus more context dependent independent communicators, and now it's really not that way anymore.
At what level, I guess, do you decide to transition a student from a low-tech or a mid-tech device to a high-tech device?
Okay, so I'm not a huge fan of low-tech and mid-tech devices, to be honest with you.
Oh, I'm not either until it becomes a discus. That's my fear.
Right. I struggle with low-tech and mid-tech because it doesn't give me access to comprehensive language. So I very rarely would recommend a light tech or low tech or mid tech system. I tend to recommend those more for students in classrooms for participation. So, we may have a communication device that's set up for a particular cooking activity that we're using or a storybook that we're reading.
And are you thinking of like Pod in that situation, or?
Well, see, I think Pod's sort of a different discussion, I think, because, Pod is like, when I think light tech, low tech, I'm thinking like minimal access to vocabulary, one page per device. And Pod books are comprehensive language tools. So I consider Pod to be, I mean, maybe I shouldn't say it's a high-tech system, but it kind of is a high-tech sort of vocabulary organization. Do you know what I mean?
Yeah.
So, I don't even think about that the same way as I do some of the, I don't think it belongs in the same category. Now, if you're asking me when would I move from like a Pod book or a comprehensive communication book into a high-tech system, that to me is a different question. And I think it's a hard question because I think it really gets down to independence of communication. As people want to be more independent, I think a high tech system that voice output system is obviously more independent than a Pod book is. But a Pod book also takes away all of those access challenges, for kids so that they can communicate, so I don't think there's a good single answer to that question.
Yeah. Okay. Well, it was kind of a trick question. It was a trap. So I just was curious what you would say there. And I know there is.
Did I pass the test?
You totally
You
passed.
did. You passed it. I know that there is a pod app now as well, but I think that it really mimics the flipbook piece.
Yeah. Oh yeah, for
now,
sure.
how about students that are medically complex? Do you work with eye gaze systems, that sort of thing?
Oh, absolutely. Yeah, oh, yeah, for sure. For sure. Yeah, I work with a lot of kids who are eye gaze users. We work with kids who are scanners, auditory scanners.
Sure. Does that impact what you do in terms of vocabulary access?
No, I still have the same desire for those kids that I do for everybody else. I want them to have core vocabulary, and I want them to have their fringe vocabulary, motivating things for them. I want them to have phrases and social interaction, and I want them to have access to literacy. So, no, other than it can be a little bit more challenging to figure out how to do that. You know?
Sure. Well, and that's something I see in the schools a lot is the limited vocabulary piece. That's why I was curious.
Yeah, but that kind of stinks because if your issue really is predominantly that you have an access problem and you have all this to say in your little brain and you have an access problem and people start giving you 4 choices, that is horrible. Mm-hmm. I mean, I it's almost even worse than if you have a language impairment. I think it's really important to get to significant vocabulary and tools for those kids. And so I definitely go high tech with those kids. I go to eye gaze really quickly. And if they cannot use eye gaze because of visual issues, we go to auditory scanning pretty quickly for those kids.
And visual issues, you mean impaired vision, just like nystagmus or chorea, even?
Yeah, for whatever reason that they cannot access an eye gaze device, if you can access an eye gaze device, I'm going to go that direction all day long over a scanning system because of rate, right? Mm-hmm. But I have students who struggle with cortical visual impairment and then other, more, acuity issues with vision. So when I have our kiddos who have cortical visual impairment, depending on the level of that may make us lean away from eye gaze. Although I will say I have quite a few students with cortical visual impairment who use eye gaze for communication.
We get emails all the time when we get people asking us, how do you go about starting a private practice focused on AT? If you had one piece of advice, what do you think it would be?
First of all, you got to know what you're doing. That's the first thing.
That helps, yes.
So make sure you know what you're doing. I mean, I think that educating yourself is important. So, spending time learning in another setting is probably important before you start your own private practice. But then, I think making sure you have access to the materials that you need. So, I mean, I have relationships with the different device manufacturers. I have relationships with app developers so that I can access the materials I need for evaluation and for therapy, ongoing therapy with my students. So I think that those are helpful things to have. Honestly, it's pretty easy to get started because there's not enough people who specialize in augmentative communication. So once people hear you're out there and you know a little something about it, I mean, I think people come. I've never had problems with a waiting list. Let's just say that.
Yeah,
right,
I know.
Me neither.
Yep. There's not enough out of us out there.
No, there's not.
Vicki, do you have materials on YouTube or anything like that?
We do have, so we're all over, I'm all over social media just because I really believe that's where our families are. And, now even our teachers and professionals are out on social media. So under our name is AAC Chicks on Instagram and Twitter. And also if you go over to YouTube, you can look up AAC Chicks on YouTube as well. I don't do a lot on YouTube, but there are some videos there. A lot of videos of people using communication systems. So that's kind of cool. Like I take kids there so they can see other students using devices.
Perfect.
So, yeah.
Great.
And I guess probably as far as getting materials too, the other thing that we should say is that, I do that assessment series on Practical AAC, their website. And I have lots and lots of protocols that are available that are within those blog posts that people can download and use for free too.
And we can link to that in the show notes because they are absolutely fantastic. I have read almost all of your articles, Vicki, and they're just so comprehensive. And for anybody who's, feeling a little daunted by the evaluation process and the assessment for AAC, you're just getting into it, they're such a great resource. So I would definitely recommend going there.
Appreciate it. It's fantastic. It's been so useful, and it's been so useful to me, and it's something that doesn't, take 6 hours to do, like certain other assessments. Well, once again, thanks for your time. Again, this was Vicki Clarke. My name is Lucas Stuber, always with my friend Rachel Madel for Talking with Tech, presented by Speech Science. Stay tuned for the next episode. We're looking forward to sharing more with you guys.
Thanks, guys.
Well, welcome back once again to Talking with Tech. Thanks so much to Vicki Clarke for joining us. I thought that was a fantastic interview.
Yeah, she's so fantastic. And especially towards the end, I feel like she's really practical in all of her suggestions. And these are the real clinical decisions that we come across in our practice. So it was really nice to hear her perspective.
Well, we want to hear from you. So drop us a line at tech@speechscience.org or find us on Facebook, either the page or the group Talking with Tech, as well as the Twitters and the Instas and the Pinstas. I think we're pretty much everywhere out there. So we're able to be found. We would love to hear from you. As well tomorrow, so if you're listening to this on Sunday, so Monday evening this coming week, we're doing a free live webinar, Rachel, Chris, and I, about new AAC apps and developments in the app world. That's at 6:00 p.m. Pacific through Exceptional Ed. We'll have that information up on the Facebook as well. We'd love for you to join us.
And if you guys haven't already, please go to iTunes and subscribe to our channel. Leave us a review and tell us what you think. We'd love to hear from you.
Well, once again, for Talking with Tech, this is Lucas Stuber, joined by Rachel Madel. Thanks for listening. We'll talk to you next week.